Somebody tell me what we call number 1 right here.
Is it the SA node?
It is the SA node. Well done. And then, so that's going to start the signal. And then the signal is going to go to number 2. What's number 2?
The AV node.
AV node, good. And then it's going to travel down the pathway, down the AV bundle, number 3, or the bundles of His, then go into what's labeled number 4, left and right bundle branches, and then finally end all throughout the myocardium and the ventricles. Somebody remind us what number 5 is. And if you are thinking Purkinje fibers, you are correct. All right, so let me just go to the next screen. So the SA node establishes a rhythm. It has its own rhythm, but sometimes we might want to speed it up. Sometimes we might want to slow it back down. So that's right in the middle of the screens. All right, right in the middle of the screen, we've got sympathetic. That's going to speed it up, and parasympathetic, that's going to slow it down. The sympathetic ties into the SA node here. That will speed it up, but the other interesting thing is notice that the sympathetic nerve branches go out into the ventricles because they can also change how the ventricle myocardial fibers, the muscle, is contracting directly. It can make them contract more forcefully. The SA node, when it goes in there, it's going to speed up the contractions. And then these other nerve fibers going into the myocardial directly, it just makes them more forceful. So the SA node will speed it up, that hits the gas pedal, but at the same time, it makes it more forceful so that with each contraction, it's sending out more blood. The parasympathetic nerve fibers, all that does is just slow everything down. That's hitting the brakes. Which nerve is this? Number 2 right here, where I got the question mark. What parasympathetic nerve goes to the heart and to many other places throughout the body?
Vagus.
Vagus. Well done, Paige. So yes, so remember, when you stimulate the vagus nerve, you're going to decrease blood pressure. How are you doing that? Because you're going to slow the heart rate down. And what can be an outcome of overstimulating the vagus nerve? Nobody remembers the story? Yes, you can cause syncope or somebody to pass out. So I've heard. I've heard stories that this can happen. So anyway, so all these different nerve fibers, also notice down here, sympathetic, we want to speed up, fight or flight, goes to the adrenal gland, dumps epinephrine and norepinephrine, which then travels through the blood and also has an effect on contractions of the heart. So this would be the point in class. Unfortunately, we didn't get to do this where we were going to practice taking pulses. So I encourage you guys at some point, go use this slide and see if you can find these different pulses. The trick, pulse points, what it is. So first of all, I didn't mention this. Arteries are always deep. They're higher pressure, and it's actually a pretty nice design because it keeps them more protected. You got lots of muscles and other tissue protecting the high pressure arteries, makes them less susceptible to damage. But a pulse point, what defines a pulse point, it's where you've got an artery that lies over a bone for the most part. So to feel a pulse, you need to gently press where that artery is and then put some pressure on it. So you're basically squeezing the artery between the bone and your fingertips. And don't use your thumb because your thumb can actually have its own pulse. So when you get a chance, try to find these different pulse points in yourself. But if we're in class, that was one of the things that we'd have a chance to do. So moving on. And then you can see factors that influence blood pressure, and then factors that influence ultimately what we're interested in up here at the top is cardiac output. That is, what is the heart sending out? And so notice you've got the key down here in the lower left. So you've got Increasing it in green, decreasing cardiac output is in red. And then what I added to the slide are all the different stimuluses. And so if it's got the box around it, it's a different stimulus that then feeds into multiple feedback loops. So there's just all kinds of different things that can cause your cardiac output to increase or decrease. All right, so a little bit about blood vessels. So you guys probably had heard of arteries before, but arterioles might be new. So they're just the intermediaries before we get to capillaries. And then venules might have been new to a lot of you guys. So again, they're just intermediaries on the way to the veins. The construction is basically the same. 3 layers: endothelial, muscle, and then connective tissue. Capillaries don't have smooth muscle. Capillaries are going to be the endothelial layer and then straight to some connective tissue on the outside. So arteries going to be nice and thick, especially the muscle is really what's going to make them much thicker. You can see that here, compare and contrast the muscle on these 2 pictures. Right, so capillaries, exchange of materials, that's their job. So they need to be thin, and notice that the gaps in between is where stuff is going to come in and out. So these precapillary sphincters can really play a crucial role in whether blood gets to tissues or not. This is how, when your fingers get cold, this is part of the reason why, is because your body recognizes you're losing a lot of heat and we don't want to. And so your body actually shuts down blood flow out to your fingers using these precapillary sphincters, so you don't continue to lose extra heat. And so that's why fingers and toes get cold. It's not so much that we can't heat them, it's more of a matter of we choose not to heat them as much because we don't want to lose our heat. So the valves, we talked about valves briefly before when we talked about blood clotting. It's because in veins, there's low pressure. And so if there's nothing pushing back here, if you take away that, this blood would want to backflow. And we want the blood to eventually make it back to the heart. So it's veins, especially the farther away you get from the heart, the more valves you're going to have. So especially down in our legs. But even in our abdomen and our thoracic cavity, the diaphragm. So every breath you take is moving blood back to the right side of your heart. Every movement you make is moving blood back to the heart. Now, obviously, when we're sleeping, we don't move as much, but we're also horizontal, so it doesn't take as much effort to get the blood back to the heart. And then coupled with the muscles, the valves keep everything moving one direction. We talked about blood clots, but this is the one that I know caught some people's eyes. So there's a term for this. We call this a blood reservoir. So we actually have a reserve capacity of blood. So say we do leak a lot of blood, we hemorrhage. Luckily, we have a bunch of blood sitting in our body that's not being fully used. And so we have the capacity to lose some blood and replace it without seeing detrimental effects. We also have the capacity to donate blood. And so basically when we donate blood, we're donating out of this reservoir in our veins. And that's why we can do it. You can't take too much though, because then you will start seeing impacts on that cardiac output chart that we had earlier. Don't worry about that. And if you followed through, basically, we do not want water in this airspace of our alveoli, even though we haven't studied respiratory. We want this all to be air. So any water that collects in there, we want to be drained out. And that's what these arrows right here in the bottom are showing. How do we do that? Ion concentrations, just good old-fashioned osmosis. Remember, water chases ions. And so if you have over here, if you've got a bunch of solutes building up, that's where all these dots are showing, water will chase it, trying to fix that balance. And then this is the part where I would have given you guys handouts and you guys would have learned a bunch of these blood vessels, but we're going to skip that part. There's one interesting thing I want to stop on here. We'll talk about this. The circle of Willis. So right here at the base of our brain is this circular ring of blood vessels. And basically the brain gets all its blood off multiple branches. Notice where we are, pituitary glands, so really bottom of our cranium. And this is, if I had a skull sample to show you guys, I really wish I did. Try to use your memory though. When you're looking at the inside of the cranium, those skulls that we could cut in half, the ones that Madeline would often have on her desk. Remember how rough that is in that region? So when often in head trauma, especially when the head is stopped abruptly, those rough points at the bottom of the skull can do damage to these blood vessels. And that can be very fatal very quickly. Anybody know, if I say the name Dale Earnhardt, does anybody know who I'm talking about?
No.
No, not a one of you? So he was a NASCAR driver. Maybe it's been just long enough now. He actually died on the track, died at the Daytona 500. He crashed his car going full speed, pretty much head first, right into the wall. So he went from about 200 miles an hour to 0 in less than a second. And so his body was belted in, but his head was not. And so what happened was, as his head snapped forward, basically his brain moved very quickly across the inside of his skull. Oops. And this circle of Willis was taken across all those rough edges on the bottom of his cranium and broke. And he very quickly died from basically a stroke, because none of his brain was being fed with blood anymore, because the circle of Willis was broken when he crashed his car. So that's my story about how dramatic these injuries can be. And that's also why, again, if you guys follow NASCAR at all, that's why now, immediately in the aftermath of that accident, now all NASCAR drivers have a device that their head is attached with straps to their seat, and it won't allow their head to snap forward in the event of a crash. And it's to prevent the kind of injuries that Dale Earnhardt died from. All right, so I want to get to veins. So the normal path of circulation, let me get to the normal path of circulation. I'm going to start up here in the heart, is blood comes out of the heart. So in the case of pulmonary, goes to a capillary bed and then returns via veins back to the heart. Or in systemic, comes out the aorta, let's go all the way down to the bottom, down to the legs, goes through a capillary bed, then returns in veins to the heart. You can see that in the trunk, so think your abdominal muscles and all that. But then look right here at this region, going from the spleen or from all the intestines. It looks normal to start with. We have arteries that feed capillaries, which feed veins. But then look what happens. They go through another group of capillaries in the liver. And this system is called the hepatic portal system. And because basically what we want to do is stuff coming from the spleen. Somebody remind us, what is the main job of the spleen? And it's actually on this PowerPoint slide, the answer to that question. The answer is hemolysis. Can anybody remind us what hemolysis is?
Is that when they make the blood?
The opposite of making, it's when the red blood cells are broken down. So remember, red blood cells are constantly being broken down as they wear out. That is called hemolysis. That happens in the spleen. So all those products of breaking down the red blood cell, they get sent to the liver. And then all the products of digestion often need to get processed further. So rather than send out all these materials that the body can't use, we send them to the liver. The liver processes them, and now they're in circulation and ready to be used elsewhere in the body. This also is true for toxins. So if we ingest toxins in our intestine before they maybe get to our brain, way up here, the liver has a chance of detoxifying the blood a little bit before these toxins can have detrimental effects. So think alcohol. So if you ingest small amounts of alcohol slowly, you're not likely to feel the effects. Why? Because that alcohol is being processed out by your liver before it can get to your brain. But if you take in larger volumes of alcohol in short amounts of time, your liver can't process it all, and much of that alcohol will get through, and we'll see the effects in the brain of alcohol intoxication. So may I have any questions on the hepatic portal system? All right, and then if you stress your valves out, they can fail. And that's the idea of varicose veins, is basically these valves have failed, and so the veins start swelling with blood that they're holding on to. So here are small spider veins or varicose veins. The picture on the next page shows you a little bit more drastic example. And so what we see here is down in this portion of this drawing, the blood is building up. So not only is it building up in the vein right here, but it's building up in the tissues. It's not being carried away. And this can be bad. So you can see ulcers, leg swelling. Basically, it can lead to a condition called cellulitis, which is basically the tissues of the skin and the hypodermis start swelling up just with fluids. They start collecting fluids and water, and all in all, it's, the cellulitis, the part that I've circled, that can be bad. Varicose veins, for the most part, they can just be unsightly, but in and of themselves, they generally don't cause any pain. And so, like I said, that's if you stress the valves out. So what kind of things do you guys think would stress the valves out? Who's going to be more likely to have varicose veins?
Older people?
Okay, so certainly it's going to manifest in older people, but there's actually certain. Let me even ask you a different question. There's actually certain occupations that are more at risk for developing varicose veins.
Well, my grandma's a nurse and she has them.
Right, because think about nurses. What is day to day for a nurse? How do they do their job?
They're on their feet.
They're on their feet, and they're on their feet and often stationary on their feet. And so nurses, teachers, police officers, basically occupations, factory workers, where you're on your feet, but relatively stationary. Because remember, what moves the blood out is the muscle contraction. So just because you're on your feet Now the blood has a hard time coming out of the veins. And if you're not moving, that means you're never contracting and squeezing the blood out of the vein. And so you're stressing those valves out. And so later in your career, later in your life, nurses, teachers, police officers, factory workers are all at a much higher risk for varicose veins. Like I said, in and of themselves, mostly unsightly, but they can long term lead to these other complications, such as cellulitis. All right.